Hello, Professor. Welcome to my presentation for AIDS, Epi and Control class. Let me just get this ready for presenter view. Okay, so to start off, my project is titled The Silent Struggle, HIV/AIDS, and Its Long-Lasting Damage to Honduras. The objectives of my project were to provide a brief background on Honduras and its socioeconomic status, as well as geographic size, population size, stability, and HIV situation in and around Honduras, as well as the outbreak history of HIV and AIDS, and how the country was able to use methods of surveillance to identify that the epidemic was occurring, and the epidemiology of HIV/AIDS in Honduras. Finally, to discuss some preventative measures that have been taken by the Ministry of Health in Honduras and the barriers to healthcare, and as well as how it can be assessed so they can improve in the future. So, a background of Honduras is that it's a country in Central America. It has a population of about 10.1 million in 2025 and is categorized as a country with a tropical climate and a large amount of mountainous regions and islands, most famously known as the Bay Islands, home to popular tourist areas like Roatan. It has a rich history involving Mayan civilizations who were conquered by the Spanish circa the 16th century, as well as a diverse population comprised of a number of varied ethnicities, most prevalently the mestizo ethnicity, which comprises someone of being Spanish European descent and Indigenous American as a mix. 5% being Amerindian, um, and then the rest being Black and white. The ages in Honduras are also diverse. 15 to 64 years takes up the largest percentage, as well as 14 and under. A fun fact is that the five stars in the Honduran flag represent themselves and its four other neighboring countries, Guatemala, El Salvador, Costa Rica, and Nicaragua. To provide some context on the information provided in the last slide, this is a map of Honduras, and as you can see here, the country is divided into 18 departments or departamentos. You can think of these as being like counties. Here we have in Florida, Broward, Monroe, Miami-Dade, and the most uh, densely populated areas are Tegucigalpa and San Pedro Sula and Cortes. And these other areas are usually mountainous. And these islands over here are the famous Roatan area where a lot of cruise ships and tourists visit. This is the flag and the five stars that I mentioned that represent all the different countries because when the flag was um, made, they wanted to reunify the countries and make a republic. That was their goal. And then this is the Copan Ruinas, which are located here in Copan. And they are very important because they show that Mayan civilization did exist in Honduras. And they're lesser known than, let's say, the Mayan monuments in Mexico, but they are still a important tourist attraction. And another picture of the common music and dance that resides in Honduras and the very prideful nation. So unfortunately, as Honduras is very beautiful and diverse and rich in history, it is also one of the poorest countries in Latin America, and it struggles daily with corruption and violent crime. As a developing country, it has struggled to grow socioeconomically due to a history of violence and natural disasters, such as hurricanes. It has been predicted in the past that the improvement of the socioeconomic status is possible, but that challenges that come with crime and natural disasters are always present. And although the economy is mostly supported by a high production of goods such as coffee, bananas, and textiles, It remains a low income, middle income country and in that developing status, and unfortunately has the highest burden of HIV and AIDS ever recorded in the Central Americas. Second, to continue on, the HIV surveillance methods in Honduras consisted of identifying in 1984 a man who traveled to San Francisco and was first to be diagnosed with Kaposi sarcoma and HIV antibodies. And later on, it was found that four men who traveled abroad also contracted HIV through both heterosexual and homosexual transmission. This is important because by 1985, the country was not aware of the disease's long incubation time, and the underreporting of patients allowed for a sharp increase in cases afterwards. Um, and it's also important to know that it took the resources from outside countries like the United States and the CDC to be able to come into the country and educate local health workers on both basic and advanced field epidemiology to combat these high cases. In order to find out how cases were spreading, the UN AIDS in 2004 conducted a behavioral research, um, and this was carried out to ascertain the prevalence of HIV and other STDs among the most vulnerable groups. Another slide concerning epidemiology of HIV and AIDS in Honduras. Like I said before, the prevalence of HIV among most Honduran adults is 1.5%, and this was found by the CDC. It affects mostly groups in the young ages of 20 and 39. It has been found that heterosexual transition, up to 60%, is the primary mechanism of infection, and as well as being a high burden in women, especially women of reproductive age, as well as military recruits and sex workers, as well as high rates of vertical transmission due to those women who are of reproductive age and having children. One common trend that I've seen in that in Central America, there's a low prevalence in the general population, but a high prevalence in specific at-risk groups, like the ones I just mentioned. And to continue on, to give an idea, up to 47% of women are affected. So a large percentage of women in the Garifuna group, as well as sex workers, um, are affected by HIV and AIDS, as well as military groups, prisoners, and men who have sex with men, as well as other members of the LGBTQ. And this was a chart provided by the US AIDS in 2011 that was able to find the cumulative AIDS cases in by about 100,000 people. As you can see here, this is the Cortes department where Puerto Cortes lies, as well as San Pedro Sula, which are two areas of a lot of movement in the country, which holds a very large airport and a very large port city. And the main mode of infection um, is heterosexual transmission, up to 60%. Um, I wanted to highlight a cultural and ethnic gem of Honduras. The Garifuna community is found on the Honduran Atlantic coast, and they are their ancestors helm from West Africa and are Afro-Caribbean. The Garifuna have a rich dance and music history that are recognized by UNESCO, as well as they have their own language. HIV is one of the greatest risks to their existence, their culture, and their language. Um, it has been found by standard research by the CDC and the Honduran Ministry of Health that their HIV prevalence rate is 4.5%, which is a high, 5 times higher than the national rate in Honduras. A common thing that the Garifuna have with the rest of the general population in Honduras is that the women continue to be a particularly marginalized group. And the difference is that they have, through their own culture, have been subjected to extreme forms of treatment, such as forced sterilization. And the worry is increasing of vertical transmission through these Garifuna women transferring HIV/AIDS to their child at delivery. And the main problem with the Garifuna and AIDS is that they have generally low rates compared to the rest of Latin America. But since a lot of people don't know or are aware of their existence, not a lot of attention is given to them through the media, and their grave health danger is not given the attention that it deserves. And to continue on the barriers of barrier health, and the main issue is access to treatment. A lot of the Honduran population do not have access to improved healthcare, especially in rural areas, and it's virtually non-existent in some areas. Uh, 1 in 5 individuals are living in extreme poverty, while 66% of the entire population is living in poverty. Um, the Ministry of Health covers nearly 90% of Hondurans, but these services are only available in big cities, so it is very difficult for rural communities to get the quality of treatment. And one of the biggest barriers to healthcare is that the lack of access to doctors, as well as health insurance. A startling 90% of individuals do not have any health insurance. And social stigma is also a great driver into why people do not want to seek care, especially in those larger communities, because they are afraid of, social setback as well as violence. But on the positive note, Honduras has been able to implement certain efforts to prevent and protect. In 1999, the CONACYTA was put in place to be in charge of creating and promoting national policies and programs related to promotion, prevention, treatment, and impact alleviation, um, with assistance from UNAIDS. Um, Many governmental and non-governmental associations, such as churches, NGOs, schools, have been more focused on providing prevention methods and education, especially with those communities who are more at risk, such as sex workers, members of the LGBTQ, as well as populations who travel a lot throughout the country and out of the country, and members of the Garifuna ethnic group. Um, it has been implemented into the schools as well, reproductive health, education, as well as education on STIs and HIV/AIDS. I think it's really important to also highlight that the Garifuna have developed their own methods to educating their community and spreading knowledge about prevention. And these methods um, including these education methods in their traditional music forms and accompanying in their performances enabled in their own language, as well as the Pan American Social Marketing Organization, or known as PASMO, has been able to include education through bingo games, where each location on a playing card displays images of HIV, AIDS, or another STD. Another marginalized group that I did not see much in the literature that I found was sexual abuse victims and survivors. But it's important to note that Doctors Without Borders in San Pedro Sula have been able to come in and provide HIV prevention, treatment for sexually transmitted diseases, emergency and routine contraception, as well as social support, mental health care to these sexual abuse victims. An assessment of HIV, AIDS, and control and prevention. It's important to know that Honduras has put the whole population in the list of at-risk groups, and I believe that this the Ministry of Health should change this into reevaluating who is at risk and providing the little resources that are given to them to those who are more commonly known at risk, such as women, men who have sex with men, commercial sex workers, inmates, and populations who travel. Um, a national condom distribution program would also be important in health education, as well as expanding coverage to adolescents, providing follow-up for them, as well as controlling, um, mobilized communities in drug and alcohol use, violence, teen pregnancy, and HIV, as well as continuing support for these communities. Um, the future of the silent epidemic is not great. As of February 2025, US funding, which is the primary backing of support in Honduras for the HIV and AIDS um, epidemic, have stopped due to a US stop work order. Um, and this has seriously disrupted Honduras's HIV response in just a couple months. It's been found that 100 healthcare professionals have ceased delivering life-saving services, and this has been found in the past that when you pull these resources, such as it was in 2005, that a lot of the progress is lost because the country solely depends on outside groups to help them with their response. Concerns about growing number of AIDS and HIV/AIDS diagnoses in Honduras are heightened by the prospect of further government budget cuts. So, in conclusion, Honduras has had a long and complex history intertwined with the HIV and AIDS crisis that has given a global burden as the highest uh, uh, cases in Central America. It's been found that many different at-risk groups have been affected, and as a result of low socioeconomic status and violence and corruption, as well as high amounts of social stigma and low education. Most importantly, being able to direct assistance to these at-risk groups, such as the Garifuna and those others that I previously mentioned, can lower mortality rates by a large margin and improve not only a health crisis, but the overall state of social justice, equity, and human rights for Honduras. And I thank you for watching my presentation, and thank you for giving me the opportunity to talk about a country that is near and dear to my heart. My mother is from Honduras, so I hope that you were able to learn something new, and I hope you have a great summer, and I hope to see you around in my further studies. Thank you. And these are my resources, and that's it.